the National Human Rights Council sends notice to the Tamil Nadu DGP and SP of Tuticorin, Kovilpatti Sub-Jail SP over the custodial deaths of Jayaraj and Benix. In fact, the NHRC seeks inquest report, post-mortem report, the treatment records of the victims, screening record of both the victims at the time of admission, and any other report of inquiry conducted in this case. Asks the response to be filed within 6 weeks, failing which the NHRC warns of action. More news that's breaking this minute. Mirror now has spoken exclusively to one of the eyewitnesses in the alleged Thoothukudi custodial death case, who has now claimed that she hasn't been provided any protection as promised by the Kovilpatti magistrate. The eyewitness, who works with the police, claims she fears that the higher officials might cause hindrance to her work since she has spoken out against them. The eyewitness has admitted to seeing Jayaraj and his son Benix being assaulted by the brute cops. Listen in to that exclusive conversation.
சாரி மேடம், ஒன்றும் இல்லை. இப்போ மேஜிஸ்ட்ரேட் உங்களுக்கு என்ன மாதிரி பாதுகாப்பு கொடுக்கணும்னு சொல்லியிருந்தாங்க. அவங்க ஏன் என்ன மாதிரி நீங்கள் கேட்டிருந்தீங்கன்னு தான் கேட்குறேன், வேற ஒன்றும் இல்லை. நாங்கள் இதுக்கப்புறம் எஸ்பிகிட்ட கேட்கலான் இருக்கோம், ஏன் இன்னும் பாதுகாப்பு கொடுக்கலன்னு, அதுக்காக தான் கேட்குறோம். சரி 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 மேடம், இதனால உங்களுக்கு ஏதாவது புரியுது மேடம், புரியுது. இது சம்பந்தமா நாங்க உயரதிகாரிகிட்ட பேசவா? நாங்க இது சம்பந்தமா உயரதிகாரிகிட்ட ஏதாவது கேள்வி கேட்கவா? இந்த மாதிரி சொல்றாங்க, அவங்களுக்கு தகுந்த பாதுகாப்பு தர முடியுமான்னு கேட்கவா? சரி மேடம், அதை நான் சொல்லிடுறேன். ஒரே ஒரு கேள்வி மேடம், நீங்க அந்த சம்பவம் பாப்பு இருக்கும்போது அங்க இருந்தீங்களா? இது நடக்கும்போது, ஜெயராஜும் பெனிக்ஸுக்கு அது நடக்கும்போது? சரி சரி மேடம், தேங்க்யூ மேடம். நாங்கள் உயரதிகாரிகிட்ட பேசிட்டோம். தேங்க்யூ மேடம், தேங்க்ஸ்.
Let me bring in my colleague Pramod, who's joining me on the phone line, getting us further updates on this. Pramod, we just heard that entire audio reaction there coming in of the eyewitness who has narrated her entire ordeal to Mirror now. But what is important here is to note that despite the promises that have been made by the Kovilpatti magistrate to give her the protection, it doesn't seem like that has happened, and she is now fearing for her life.
It certainly is, and not today, but that moment Madras High Court order came that PVCIT should initially immediately start investigation itself. Madras High Court also very clearly mentioned that one of the eyewitnesses has come forward and spoken on it, and the eyewitness must be given adequate protection because the witness was already fearing for her life. But to our shock, we have just come to know from the witnesses and itself that no protection has been given, and what she's looking for as protection is not some kind of a bodyguard or such, but she just wants no officials to cause any hindrance to her work or her husband's work, and she just wants to do her work in peace. That's what she wants. That itself shows the kind of resilience of the witness, who has only spoken to a person who has come forward to speak against the police brutality that has occurred in Kasargod.
All right, Pramod, request you to stay with us at this point. We're getting more updates now coming in. Remember, just today after the Madras High Court made some strong observations in the alleged custodial death case, the CBCID team has intensified its probe into this entire matter. The team has sealed the Sadankulam police station, where the father and the son duo were allegedly tortured to death. The team, in fact, also visited the victim's shop to further probe this entire incident. Meanwhile, the revenue officials have taken over the police station after the High Court's directions there. Remember, it has been over a week since the death of both the father and the son, but so far no FIR has been filed against the brute cop so far. Let me once again bring in my colleague Pramod for further updates on this. Pramod, since morning, what has been the kind of developments we are looking at as far as the CBCID probe is concerned? Because even as we speak, there has been no FIR that has been filed in this case.
Well, the CBCRE started like initiating collecting data, evidence and information from the ground, and that's like today morning as well. Like many teams have gone to various locations. One team to Jairaj and Phoenix's residents. One team to Jairaj and Phoenix's cell phone shop, where other people have come forward to speak about what exactly happened. And we also have the CCTV footage where how many people were standing on that area, and they all saw Jairaj being cordoned by the police, and
Okay.
the father went quietly, unlike what the FIR said about them rolling on the ground and hurting themselves. All those information are being gathered by CBCID teams in various locations, and it's expected that once it is done, the FIR could be filed by the CBCID anytime soon.
All right, Pramod, many thanks for joining us and bringing us all those updates in this case. More reactions now coming in at this point. Actor Rajnikant has now reacted to the alleged custodial death of the father and the son. The actor has expressed shock over this incident and has said that the erring corpse should not go unpunished at any cost. Let's now shift focus and get you other updates now coming in. This coming in from Mumbai. Today, remember, is the National Doctors' Day, and the entire country is expressing their gratitude to our frontline health warriors who have been at the frontline dealing and treating the coronavirus patients across. Now, remember, let's go across to the Bombay hospital where my colleague Disha is currently joining us live from one of the COVID wards there. Disha, over to you. On the occasion of the National Doctors' Day, we of course salute the work that has been done by all the doctors across the country and the relentless effort in working day and night. Tell us about where you are and what is happening there, and in what way are we looking at this day being celebrated as well?
Well, that's right, Apurva. Today is a very special day. It is time to salute our heroes who work round the clock for us here across the country. They sacrifice their own time. They sacrifice their own time to stay with family only to help us, to save us. And this year, it's even more important to really thank all the doctors who are working here non-stop, round the clock, is only because the COVID pandemic has hit us and the life has changed for each and every doctor here for the last 3 months. Right now, as you can see, I am inside the Bombay hospital, which is a private hospital here in the city of Mumbai, inside the ICU COVID ward. And as you can see, me and my video journalist, even we have worn a PPE kit, and so the doctors, they wear it for 8 long hours, Apurva. Let's directly go and speak to the doctors here in concern. I'm joined here by Dr. Gautam Bansali, who's the consultant and physician here at the Bombay Hospital. He's also the chief coordinator of all the private hospitals across Mumbai. Thank you so much for speaking to us. And firstly, happy Doctors' Day. I know that it's one day is not important to celebrate what you all do for everyone, but I just want to know how life has changed in the last 3 months. What are the challenges that you all have to really face, because this particular disease was new? What exactly were the hardships initially?
See, one thing we all should understand, this is a totally new disease, and every day there are new kind of challenges are there. Every day we see the protocol we are changing, we are changing the discharge policy, we are changing the lab testing policy, we are changing the tracing policy, we are changing the that how to admit or what kind of patient we should admit. But it's a different kind of situation. We all should work, and we all doctors and nurses, all sweeper, ward boy, all healthcare workers are working very hard to chase this virus. Our policy is to chase this virus. Definitely, it's a different kind of situation. We never use this kind of PPE. Last 15 years of my practice, I never used this kind of PPE kit and all the things. But we should work, and society need doctors, society need nurses. So we all want we should work, and our chairman Bombay Hospital, who is a very philanthropic man, Mr. Bharat Kumar Tapadia ji, he wanted all doctors should work, and all doctors give their duty. They want to work. They want to fight with this coronavirus, and I am sure with this kind of josh, the situation you have seen in the ICU, with this kind of josh, we will definitely beat this virus, we will kill this virus, and we will chase this virus.
Thank you so much. Apura, we'll also try and speak to more frontline workers here, the health workers, the doctors here who work round the clock only to give us the best possible service. So if we can just speak to you about your own personal experience, like Dr. Gautam Bansali was saying, you all did not wear PPE kits for the last 15 years, and to adopt something which was very new, what were the challenges for you?
Challenges were getting accustomed to the PPE suit, managing patients, not knowing about the disease. We are learning with each passing day. But at the end of the day, the most satisfying part is when the patient is cured, he walks home, we bring a smile to everyone's faces. That's the only thing we all strive for, to keep everyone healthy and safe. And I'm sure with a collective teamwork, we're going to defeat this virus together.
Happy Doctor's Day to you. Apurva, we will just, show you that this is the ICU ward where we are. We will not really show the patients, but we want to show that what kind of medical infrastructure that these doctors had to really adopt to with new sort of technology, with new, sort of things. What we'll also try and speak to one nurse here, one sister who's been really working around the clock as well, and she is having a smile on her face. So this, we can really say that what exactly, how important. Happy Doctor's Day to you. How difficult it is, to manage yourself in a PPE suit for 8 to 10 hours a day. What are the difficulties?
Actually, we are struggling work with this PPT because very hot inside. Anyway, it's not a thing. We know the society wants us, so we are struggling to work for the people. And also, we people are enjoying to work in Bombay Hospital 6 hours. And just now, and also I'm feeling like that I'm a Power Rangers, like a Power Rangers. That's all.
Thank you. So we'll also try and just speak to one last doctor here because we do not really want to disturb the patients out here. But we will just talk to one last doctor, know about his personal experience as well. And this is a hospital, Apurva, which has a 100-bed COVID capacity, including 44 ICU. And where we are, there are approximately 30 patients who have been admitted. And they are the doctors who work in shifts, at least 9 to 10 hours a day. Thank you so much for speaking to us. Happy Doctor's Day. I know one day is not enough to celebrate what you all actually do for us. But just to, tell our viewers what exactly have been your personal experiences, because you all sacrifice your family life for us. You ensure that the COVID patients get recovered and they are discharged without any, problems.
First of all, thank you so much for realizing all these things. Most importantly, I will tell you that yes, it is a very, you can say that very different experience and all that we are feeling now. Because in my career of almost last 16 years, I have been working in the ICU. This is the first time we are wearing the PPE. And it is definitely not very pleasant experience. Plus, because of this COVID and all that, definitely the more panic is among the healthcare people, especially the doctors, nurses and the ward boys and all. So we all are also worried about our families and this thing. Now myself, for my wife and my kid who is 5-year-old, this thing. But we are trying to take over all the fears and all that and try to be more towards the patient. And as a Bombay Hospital team, we are trying best of our efforts to get them better. Our almost 500 plus more than patients have been recovered and almost discharged from this thing. Every day we are getting new cases, more of critical cases. We are trying best. Our team is trying our best. Our resident doctors, our senior consultant intensivist, in spite of the comorbid conditions and in spite of their age factor, they are still taking a risk and coming and seeing the patient and treating and giving their valuable opinion. Not more than that, yes. But I would also like to thank our management team who is always in the background, so don't come in. Other than the clinician, our whole management team is also working. So it's a Bombay Hospital team is working great.
So here we heard the doctors, the health, frontline workers who actually work every day just to see that we get the best of the services, best of the treatment. And one day is not only enough what they do for us. Back to you.
Absolutely. Rightly put, Disha. One day is not enough to celebrate them. It has to be done every single day for the work that they are doing. Mirror now, in fact, saluting every single Corona warrior, every single doctor who has been working round the clock, relentlessly helping people get better at this point. Many thanks, Disha, for joining us and giving us those beautiful voices there from on ground. And with that, we are slipping into a very short break right here on Mirror Now. Stay with us. After the government banned 59 Chinese apps, now sources say that other Chinese firms could also face action. The Indian government is mulling over pulling out the Huawei from the 5G race. Sources tell the Times Network that the Home Minister held a meeting on the 5G auction recently. On December 2019, a high-level panel had also raised an alarm and flagged off the possibility of leak of sensitive data to China. Let's get in other updates now. Coming in, Kerala has blocked the Kasargod road that gives an entry to people from Kerala to Karnataka. Now, earlier in March, Karnataka had in fact blocked the entry of people from the Kasargod district to Mangaluru. Now, after Karnataka's Mangaluru witnessed a sudden rise in the number of COVID cases, the Kasargod district administration has blocked the entry of those using the road connecting Mangaluru to the state. Mangaluru has so far recorded 741 COVID cases, including 12 deaths that have been reported. Let me bring in my colleague Shrija, who's joining me live, getting us those updates there. Shrija, with Kerala now blocking the Kasargod road, no entry to the Kasargod from Mangaluru, what are the difficulties that people are going to be facing with this blockage?
Well, remember, Apurva, in the month of April and March and April, we did see how Karnataka had blocked that particular way, not allowing people or those who wanted to seek treatment, especially those who had, in fact, contracted coronavirus. We did see even where both the states, including Karnataka and Kerala, they were fighting over, in fact, where that particular road was blocked. We also saw that the case was just taken to Supreme Court, also telling the higher court, the apex court, also saying that the states should coordinate and the blocking of the way should immediately be removed. So today we're looking at a very different scenario where the neighboring state Kerala has gone ahead and blocked this particular road, especially not allowing the entry for people from Mangaluru district or Dakshin Kannada district to enter Kasargod district. But we had seen quite a lot of people entering from Kerala itself to seek treatment right at the border of Karnataka. But now it clearly has come down. But now we do not see much of the people, in fact, going out of the district of Mangaluru. But what we see, the kind of difficulties is that for people, the road has been right now blocked. There is no such entry, especially to Kasargod at all. You can clearly see the entire stretch of road has been covered with mud and gravel as well. So this is something that which was unexpected coming in from the state of Kerala, because it was a decision taken by the district administration of Kasargod.
Okay. All right. Shrija, many thanks for joining us and bringing us all those updates. On to some news that's breaking this minute. Coming in from down south, 6 people have been killed in a boiler blast that has taken place at the Neyveli Lignite Corporation thermal plant in Cuddalore. In fact, 16 people have been severely injured and hospitalized. Several others so far have been evacuated, but remember, on 8th of April, a similar blast had occurred in the same area, killing 5 people. This is the latest update now coming in. Remember, a blast that has been reported at a thermal plant in the Cuddalore district in Tamil Nadu. This blast has taken place in the Neyveli Lignite Corporation thermal plant. Let me bring in my colleague Pramod for further updates on this. Pramod, unfortunate news coming in of 6 people who have been killed in this boiler blast. Can you help us understand more details that's coming in? What is the situation on ground at the Neyveli Lignite Corporation thermal plant?
Well, we can simply say that the situation is definitely not amicable to, at Neyveli's plant right now, because the same kind of accident occurred on 8th of June, 8th of 2020, and 5 people died at that point also. This time also such a major plant disaster, and 6 people reportedly dead, and many are injured. In fact, as we speak, rescue operations are still on, and people are looking for somebody who might have, who are missing so far. So that is extremely scary, and the actual reason for the blast is also not yet given. So that even for back in April when the accident occurred. The reason for the blast has not yet been revealed. So that is turning into a major reason for concern as to what is exactly happening in LNC thermal plants now.
All right, Pramod, request you to stay with us at this point. We're getting more breaking updates coming in. With regards to this blast that has taken place in Cuddalore, Home Minister Amit Shah has now reacted to the blast at the Neyveli power plant. Home Minister Amit Shah saying, and I quote, anguished about the loss of lives at the power plant and assured all possible help to the Tamil Nadu government. Amit Shah further saying that he's praying for the early recovery of all the injured. Staying with more updates now, coming in from down south, where there is no end to Tamil Nadu police's high-handedness at this point. There's been another instance that has been reported, and this is again caught on camera shaming the khaki. In a video that has now gone viral, a head constable of police is seen thrashing and slapping an elderly man whose bicycle allegedly collided with the cop's two-wheeler. The incident took place on a Monday near the Trichy cantonment area. The cop has been identified based on the nearby CCTV footage and removed from his duty. Let me once again bring in my colleague Pramod for further updates on this. Pramod, once again, we are looking at the high-handedness there caught on camera of the Tamil Nadu police. Tell us about this entire incident that has taken place, and has there been any appropriate action that has been taken against this cop?
Well, this is definitely unacceptable what has occurred in Trichy, and just as you exactly mentioned, the police officer has been identified as Ilango from Law and Order Ordeal Police Station at Trichy, and what has happened is that this senior citizen, apparently the policeman's bike collided with his bicycle, and that's the reason the senior citizen has questioned about the policeman not driving it properly and sought for damages, money for damages, and that is when the policeman had got down and slapped him. Extremely unacceptable, because we could see that there are two faults with the policeman, and instead of going ahead and apologizing in the first hand, he has shown authority and done so. And even after this, he has been only transferred to AR. Is this some sort of punishment? We're not exactly sure, but for now, only that this is the only action that has been taken against him.
All right, Pramod, many thanks for joining us and bringing us all those updates. Let's bring in further updates now coming in from the state of Karnataka now, and this is Congress MLA Zamir Ahmed, who received a rather grand welcome by his supporters in Bengaluru's Chamrajpet area. The visuals that you're seeing on your screens there are of the manner in which his supporters garlanded him, welcomed him, and he could also be seen the supporters washing his feet. And there's a big gathering that has taken place, a grand welcome amid the pandemic that is already in place. Now, social distancing norms were into for a toss. His supporters could also be seen not wearing the mask. Many people, in fact, came together. It was a huge crowd that had gathered, and you're looking at those visuals there, the manner in which a large crowd has gathered to garland and shower flowers over the Congress MLA Zamir Ahmed, who received a rather grand welcome amid the pandemic in Bengaluru's Chamrajpet area. While on one hand, we're looking at cases there going up at this point, we're looking on the other side, the manner in which the supporters of this particular Congress MLA flouting all the social distancing norms in place. But that's a wrap on this edition of The Big Story. News and updates continue right here on Mirror Now.